Hello, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about the differences in the mold testing labs. There are several labs that use urine as a way to measure the mycotoxins in your urine, and there is one lab called MyMyco Lab in Florida that actually measures the immune system's antibody response, both IgG and IgE, to the mycotoxins. And I believe they measure 13 mycotoxins. After much studying about both of these techniques, they really do very different things. The urine mycotoxin test measures how much mycotoxins you are excreting, okay? And also, it's very difficult to replicate. In other words, when you do it one Monday, if you do it the following Monday, the test results are often not similar. So, and that's because mycotoxins get stored in the fat and they get released, different ways, one of which is, starvation releases mycotoxins. So if one day you starve and then the next day you eat a lot, the amount of mycotoxins that you release is probably going to be affected. Certainly if you fast more than 1 or 2 days. That's why I don't really like to use those tests. I don't like tests that I can't replicate. The MyMyco test is a blood test, and I believe it's 2 tubes, and it measures antibodies. And the antibodies are molecules that the immune system makes in response to the presence of a pathogen or a toxin. And it's I think it's a very accurate way. It's what we do with Lyme and other infections, Bartonella, Ehrlichia. We look at antibodies, and so I think it's a pretty accurate way to determine the level of immune response to the mycotoxins, and the level of immune response is going to be correlated with the amount of mycotoxins that you have. So if you have a few mycotoxins, you're only going to have a little bit of an antibody response. If you have a lot of mycotoxins, you're going to have a much bigger response. We like to do challenges, 14-day challenges for the mycotoxin test before you do it, and that's to ensure that the mycotoxins are pulled off the fat cells and antibodies are able to mount antibody responses to them. And depending on, every situation is different, but I like to use NAC, vitamin C, and Cytodetox. Some people, I like to use glutathione, but you do not use glutathione if you suspect that the patient has been exposed to gliotoxin, because that will make it worse. So I do like to use MyMyco. The turnaround time is about 3 weeks. It takes about 3 weeks to get the test results, but they have helped so many of my patients, thousands of patients. And Andrew Campbell is the medical doctor that oversees that facility, and he is readily available for questions, and I value his opinion a great deal. So I hope you found this information useful, and I hope you have a wonderful day. Take care.